Hi, my name is James Hereford. I'm the President and CEO of Fairview Health Services. And it's my pleasure to welcome the Governor here today. We're very pleased and excited about the partnership that Governor Walz has really created here with the healthcare systems and everybody else, and not just due to the opportunity for vaccination, but throughout the pandemic. I don't think Minnesota would be as healthy, would be as far forward in our ability to vaccinate if it weren't for the leadership of Governor Walz. So with that, let me turn it over to the Governor. Thank you, sir, for being here.
Thanks, James. Well, thank you to James and the folks at Fairview. The humbleness that we see out of our healthcare providers is really evident. I am very proud of the coalition that we built. And we talked about when we were building and doing things to protect our healthcare capacity, to protect our healthcare workers in the pandemic before we had vaccines. It was through the guidance and the expertise of people like James who were helping me understand what it means to have bed space, what it means to start pressing up against that, and how do we manage mitigating what's happening around COVID with getting people the health care that they need every day. And it was that type of expertise that was helpful. And then it was these folks who helped us think about what would a system look like when we needed to vaccinate 3 or 4 million people. This had not been attempted before, and it sounds like, okay, just vaccinate them. How will you do it? How will you make sure you're doing it equitable? How do you make sure you're doing it safely, especially when we had issues around trying to manage cold storage and all of that? And how do you do it as quickly as possible? And you do it by collaborating. You do it by communicating. And we had a lot of calls, and I keep saying this. What I'm really proud of is the coalition of Minnesota providers, and that is broad, from the large healthcare systems to the rural systems to the pharmacies to the VA to Indian healthcare to the community clinics to the state, trying to figure out how we all had a piece in that to make this as simple and as quick as possible for Minnesotans. And I really appreciate that the conversations were all based on, in the case of the healthcare providers, what was in the best interest of their patients, and from our perspective, what's in the best interest of Minnesotans in general. And we've been able to do that. We're here today to celebrate. Again, it's almost mind-boggling that it'll be a year ago on this coming Saturday that the first confirmed case of COVID showed up in Minnesota. And we were trying to figure out what this was. How do you get a test to show what it was? What are we going to do about PPE when we started to just find out that there wasn't a national storage set of this? And how would we prepare for someday? And I can remember talking about it and the experts telling me there will more than likely be a vaccine. It's not a guarantee. We're still chasing that on some things. But it could be years. That's the typical timeline. Well, here we are. 1.5 million doses given. Nearly 1 million Minnesotans have been done with this. And we're here to celebrate Johnson & Johnson's delivery of the vaccines to Minnesota. Friday it got its approval. Over the weekend and on Monday, the ACIP told us how this could be used and how it should be used and what people should get this. They started shipping them late Monday night, and here we are looking at vials. But this is what's most impressive. While all of that was going on, this team at Fairview was already planning. How can we get this out within 72 hours to the people who need it as quickly and simply as possible? And that's where we just came from a room that they had stripped down, opened up, ready to go, and now appointments are being made, and they will soft launch on Friday. Shots will be going in arms, and thousands will be given on Saturday. State of Minnesota got 45,200. We were back looking at over 3,000 at this site, and they will be across the state to all corners of the state within a matter of hours. So it's impressive, and what's impressive about it is it's saving lives. I'm incredibly thankful to Minnesotans that are still masking, social distancing, doing things necessary, driving down those rates of death that we know needs to be there. But I also know that we made it a priority that during this golden period of test positivity being lower, before variants are starting to be an area of concern around the country, that we get as many Minnesotans vaccinated as quickly as possible. And I'm really pleased that, according to the CDC, we're the 3rd best at this. And when I say we, that's James and his team at Fairview. It's all the hospital systems. It's everybody and the pharmacies, all people getting this done. And I am going to say that managing to keep those death rates low, managing to open up that hospital space, and managing to get these people vaccinated, because again, this is a good vaccine. It's 100% effective against death. It's almost that against hospitalizations or severe disease. It's one dose, and I'll tell Minnesotans, when you get the opportunity, roll up your sleeve and take the vaccine. You're certainly going to get to hear, and it's always your option, but know where you're at, know where these vaccines are at, and know that as far as Dr. Jacobs and others who have done this for a lifetime will tell you, there's no difference in terms of the impact that these vaccines have, and they're all positive. So really great day. I'm just thankful for all the folks who make this happen. It does feel like I said in December, I remember using it, I can't get away from, they're not really cliches, it's just kind of my life. I said we were up against it. And I asked for a goal line stand to not overrun our hospital systems or kill our neighbors. And we were up to about 100 deaths a day. The country was burning up with COVID. We buckled down. We didn't overwhelm that healthcare system. I wanted us to, in January, start getting our kids back in school. 86% of them are in in-person learning, and we've set a goal for Monday to try and get all of them we can. We've got about 58% of our educators vaccinated and 56% of our folks over 65 and above. I mentioned earlier, I just got off the phone before coming here with the CEO of Pfizer. They have just given another indication they are upping their stream of vaccines fairly significantly. And of course, with Moderna on board and things working the way they are, there's every reason for us to be very, very optimistic. And so with that being said, I'm going to take some questions, but I'm going to thank Minnesotans again. And this is a whole lot of people. This is parents. This is our nonprofits. This is our healthcare providers. This is our schools. The Save the Children Fund, the largest fund that tracks the health and well-being of our children, had a study to look at how did our children fare during COVID. And they ranked all the states who protected their children the best, and Minnesota came out first. And I said, that is our mission statement of our administration, that Minnesota be the best place in the country to raise a child and to have a family. And with the partnerships of all these folks, that's happening. COVID has taken a toll on all of us, but the days are here that this thing's done. And I'm just going to encourage Minnesotans. We did the goal line stand. We took the ball. Now we just bury this thing. We get this thing done. We keep doing the things that are necessary. Continue to get that vaccine. We need your help on that. We're going to get to a point where we're going to have plenty of vaccines. We need folks to get in and take it, because we get to that 70 to 90% range. We get the herd immunity that we need that protects not only ourselves but our neighbors. So thank you all for joining us, and we'll be glad to take some questions.
Governor, how does this arrival, I mean, you got 45,000 this week. Have you had any indication of how many more Johnson & Johnson you'll get, and how does this alter the timeline that did not account for Johnson & Johnson, nor did it account for a boost in Pfizer or Moderna either?
That's right. As I said when we first announced our timeline to give people an idea when they'd get this, now if we had President Biden and the administration saying that by the end of May every American should have an opportunity at this, it obviously accelerates our timeline. I think looking at this, and I look at the numbers each night, we were hoping to get 70% of 65 and above done by the end of March. I think we'll significantly beat that. And what you saw is that because of that, we're starting to reevaluate and add more folks, and we want to add as many as we can who are especially at risk by adding type 1 diabetes and a few other things. It's because of this allotment and the consistency we now see out there. And again, assuming we don't have a storm, or again, we're working with biologics in the manufacturing process. There's a lot of, I mean, we kind of take for granted in a modern world. This is not a miracle. It's science, but it's hard, and they did that. With that being said, we're going to see a drop-off next week of Johnson & Johnson. I don't believe we're going to see any at this time of Johnson & Johnson vaccines. We are going to see an increase, and I can have my staff get you the numbers of both Moderna and Pfizer that should make up the difference. They tell us by 2 weeks from now we'll start to see some of the Johnson & Johnson come up, and then we should see very significant numbers of those coming the 3rd and 4th weeks. But we're going to, I think, listening to Pfizer talk, and certainly today, we're going to see a fairly significant number. So we're going to be about 161,000. I would anticipate by the end of the month, and if Johnson & Johnson's production steps up the way it should, this agreement with Merck is groundbreaking, that we have folks working together. That's a story that when you fight this war, it's not about one company over another. It's all of us in it together. That is just encouraging to me, just society-wise, but from what we're going to get, we should be well over 200,000 doses per week is what it's going to look like, things that will be happening. And I think the thing that I keep saying, and this is to thank James and the experts who understand this, we asked them early on to create a system that was robust enough to be able to absorb whatever they gave us as quickly as possible. And I remember early on they were saying, well, we're lagging a little bit in these first couple weeks. You don't report the basketball game when it's 2-0. You report it once you get into the game and what's happening. And Minnesota's ability to now have this robustness, if they give us 200 or 250, and James will tell you this exactly what he says when I ask him, how much can you guys get out? How much can you give us? If you give it to us, we'll get it out. And they've proven that they can do that. And I think that's true across. So you're going to see a little lag next week from Johnson & Johnson, probably be offset a little bit by Pfizer, maybe stay relatively consistent, and then I think probably by about the 15th of March, you'll start to see a steady increase. And, I mean, I was pretty stunned. Pfizer's delivered 40 million at this point in time to today, March 3rd. They said by the end of March they will have delivered 120 million, which means they're going to deliver twice as much as they've already done in this month alone. And if some of you with your calculators out do the math, we usually get 1.67% of whatever the overall allocation is. So if you did the 1.67 of 80 million, you can start to see where we're at. And we need the ability to get it out.
Governor, what does this mean for restrictions and any thought to easing up on those anymore?
Yeah, this is the good question. It's one I know it's all on Minnesotans' mind. You've worked hard. We've kept test positivity low. James, I don't speak out of order here. I believe bed space, including ICU bed space, is probably as low as COVID usage since summer.
Back in May.
Back in May. So that's solid. Obviously, vaccinations and vaccination rates are creeping up. We're seeing almost no incidents at all, obviously, in long-term care because most of those are vaccinated. So a lot of those indicators are looking really solid, which, of course, I think does indicate one of the reasons we knew we would be in a good space by this point if all worked well. We're back in school. Our businesses, our restaurants are open at 50%. We're doing some of those things. It's now time to think about what the next steps are. And I say that's against a backdrop because some of you are listening. The CDC is saying don't make a mistake and go too fast here. Don't let the variants get back in. University of Minnesota has groundbreaking research into wastewater treatment. We're seeing a little bit of concern there on rising. We're testing for variants as aggressively as probably anybody. And right now, the variant prevalence here, what I got in the briefing this morning is somewhere around 1.5. They're thinking the variant prevalence in Texas is close to 20%. So I think when the CDC is talking, and what they're talking about, it's not even, like we've seen this outbreak sometimes in the Southwest, it's in the Northeast, it's down in Florida, it's up here. I'm trying to figure out if we can outrace this thing with vaccinations where we're at before any bump comes. I'll be meeting with Mayo Clinic folks on their modeling. We've looked at IHME's modeling. And at this point in time, it seems relatively stable. So those are decisions that we're talking about. I think it makes more sense, soon to talk about this. I have to tell you, it appears to me that the brass ring is pretty grabbable for state fair and those types of things. As you start letting people plan for June weddings, we'll be in an entirely different place. I think the real question here is, what can we do over the next few weeks before we get by what the CDC is saying is there? And I think we've always tried to strike that proper balance of pushing as close to we can as the restrictions being as little as we can put on while still protecting the healthcare systems. And at this point in time, that's a conversation we're having. So I know it's a long ways around, but it's a pretty complicated place where we're at.
Governor, you've no doubt seen that some states are going to an age-based eligibility. Michigan, for example, is making its 50 to 64-year-olds, pushing them way up in line. Have you considered that, or are you considering?
Yeah, we've considered everything, and we've looked at every state. I think one of the things that we want to do is always keep the vaccination for impact. Those folks that are most likely to get COVID, to get sick from COVID, to get hospitalized by COVID, and die from COVID, and try and get them to the line as quickly as possible. At the same time, you're starting to see that the CDC and others got there. To get our kids back in school, it's going to be important to vaccinate teachers. Well, we're way ahead of that. So, yeah, and I think that's where you're seeing us adjust on this, where there's more vaccine and more capability, adding some folks in. But we're going to very, very quickly, as I said, I think you can start to do the math on the number of vaccines we have and the number of people who are showing up, where we're going to surpass that 70% pretty much. And then what we do is I keep that analogy. We're just going to add another lane. So I think you'll start to see us add another lane. There have been a lot of different approaches to this. I mean, Indiana started out 90 and above, everybody 90 and above, 80 above. What we're seeing is that we had to measure the impact on those plus the speed. And I think, and then I'll add one more, and you're going to see more on this tomorrow, the equity piece of who's getting it and who's not getting it. And it's probably no surprise to you, communities of color are getting it less. And there's numerous reasons for that. Somebody said, well, communities of color are showing far less in these vaccinations above 65 and above. The minute we went to 65 and above as a priority, there was going to be an equity issue because there's fewer people in communities of color 65 and above because of pre-existing health issues. So the question's good and the answer is yes. We are looking at ways that we can tweak that. The good news is, I think, this idea of when everybody goes and how we get it in line is pretty much going to take care of itself over the next 6 weeks with the volume of vaccines we're getting and the work they're doing here.
This may be a question for one of the Fairview folks, but when you say soft launch for Johnson & Johnson, does that mean shots going into arms on Friday? And what needs to happen between now and then, kind of behind the scenes logistically, to roll it out?
Yeah, so that the soft launch really refers to us starting slowly, so we make sure we've tested out our kind of our workflows and things are going to work well for patients when they come to get their vaccine.
So patients on Saturday?
We're planning at this point right now to hopefully start Friday afternoon.
And does anything specifically have to happen? Is there special training happening like today, tomorrow, Friday?
Yep, the Department of Health held training today and are releasing training materials, which our staff will start using immediately to get up to speed, and then we're finishing the operational readiness of the site too.
And obviously we know it's quite a different vaccine than the other two. Is there anything specific that you guys could point to as changes on your end?
You know, operationally, not so much in terms of just the storage is much easier. It's a refrigerator vaccine, a single shot. Maybe I'd ask Dr. Jacob to comment too.
Can we get your name and quick spelling first?
Sure, John Pastor.
Right into the mic.
Oh, sorry. John Pastor, P-A-S-T-O-R.
And if you could do that as well.
Yep, Vice President for Pharmacy Services.
Thank you.
And thanks, John. I'm Abe Jacob, Chief Quality Officer from Health Fairview. So in terms of the differences operationally, as John said, refrigeration is a big deal. Not to have to worry about the cold chain storage and vaccine wastage. Significantly improves our ability to get it in communities that are, you know, where that's has been an operational challenge. The other thing is we don't have to schedule a second dose. So not having to have them go in another line to get their second dose in 3 or 4 weeks is also a big operational barrier that, you know, gets removed with Johnson & Johnson. So, and, you know, and clinically, we see no clinical difference in terms of the outcomes we're looking for. So hospitalization, death. Johnson & Johnson meets that threshold, and frankly, it's the most up-to-date studied vaccine that's out there when it's up against the variant. So we're really excited about Johnson & Johnson.
Can you say your name again?
Yeah, Abe Jacob, Chief Quality Officer. Yeah, sorry.
This may be a silly question, but did you guys have to buy more refrigerators or anything special for it?
I don't buy fridges.
So refrigerators, no. Actually, the footprint or the size of the vaccine, it's going to fit in our existing refrigerator space. That was almost 5,000 doses of that one box that some of you saw in the back today.
Can people expect the same kind of situation no matter what vaccine? Similar type of symptoms or like possible side effects, or is there any difference there?
Yeah, you know, with Johnson & Johnson, the interesting thing with Johnson & Johnson is they saw more side effects in the placebo arm than they actually saw in the vaccine arm. So the side effect profile is actually really good, and we're not anticipating anything different. In fact, we think we're more hopeful about side effects. We'll find out as we get into it, but so far so good.
Where exactly are the first doses of the Johnson & Johnson vaccine heading? Within Minnesota? Geographic.
Oh, yeah. Our systems take it that every week we do an allocation, and we're on the phones with folks, tell them where we can get them, where they can put them out, and then we make a determination of where they go. And obviously for all of you have done a wonderful job of showing this can be somewhat controversial on how we do this. But it's because it's somewhat complicated, and we're trying, and again, thinking about those things. Where can it be most effective? Where does it fit what the label says it should go? Where is the concentration of folks we're trying to get to? And then overlap that with where is the need and where is the equity piece that goes into that. So it is going to the usual places. It's going to the systems. It's going to some of the pharmacies. There's going to be some health sites set up by the state of Minnesota. These big sites you see that set up like at Roy Wilkins, we'll have permanent ones, or you see us setting them up at the Mall of America. The state's running those, but I think there's a misperception that that's where all the vaccine is. That's one small slice. The most of it is going throughout the existing system, and that'll hold true with J&J. And we're thinking about where it goes. I saw where Wisconsin made the decision. They're going to use it all in their teachers because they haven't been vaccinating teachers. And we'll start to determine some of those. But this week, this allocation went out. And again, this is where you're going to see this. And I listened to governors on there. If some states weren't set up to have the capacity to do this, they're going to be setting on those vaccines a little bit. But what we were able to do is, as James said, Jen Malcolm called up and said, okay, how fast can you move this many vaccines? And their answer is, as fast as you need them moved. And that's what's happening. So we have to say who can take them, who can get them out, and where they're at. So they're across the state.
Are you considering large drive-through vaccination sites?
Yeah, we were just talking about that. It's really interesting. The federal government is offering through FEMA, and they're doing it in some of the major areas. Houston, you've seen some of these, where FEMA has these large sites where they can get people in. And in the warmer climates, they're doing some of the drive-throughs. What was really interesting is FEMA briefed us and said, we have the capacity, we'll do these, and our large sites can handle up to 6,000 people. We're handling more than that in some of ours right now at the state level. So I think the answer to your question is yes, I think if it makes sense. And folks, we were just saying, when the weather's nice like this, maybe that makes sense. That will be, though, decisions that our providers are out there. What we really wanted this to be is, and the way it should get to, and this is what Fairview and others have done well, they've just worked through their patient list and said, hey, you're on, come on in, here's where you can get it. Folks who weren't quite sure about that, we created the portal so that they could sign up and get on. If there's a need, and we have a lot of it out there, and it makes sense that we could just do that and it wouldn't be logistically trouble, we would certainly consider it. I think now, though, where you're seeing these in certain states and you're seeing the federal government comes in, I'm not quite certain that the state has the robustness to be able to get these out. I'm very confident. If they would have sent us 145,000 doses of Johnson & Johnson, we could have got them out because we'd have called them and they would have taken just that much more across the state. I think my team is a little disappointed, the folks over at MDH, especially the Scandinavian folks. The actual name of this thing is Janssen, but they won't let us say that. It's the Janssen vaccine, and I said, well, we should call it that. And they said, no, you're going to confuse people. It's Johnson & Johnson. Let them do that. But yeah, we'll certainly consider it. I'm not sure it's necessary here, but what I'm approaching this on is the ease for people to be able to get it. The stories I want to hear, and I think this is, Dr. Jacobs brought up a great point, too, is this will even shorten your time being in the room and getting your vaccine if you're signed up, because it's one shot and you're done. And then we put it in the mix system, and we're on. They don't need to do any more.
All right, last question.
Yeah, sure.
Governor, I just wanted to ask, a couple colleagues of mine say that they've seen the numbers of people signing up for the vaccine in some more rural areas sort of tapering off, not nearly as many as before. Wasn't sure if that's anything your office or the health department was looking at and what that might be.
We are. It's a good question. It's early, but there are some indicators that that's starting to happen. We knew early on there would be, I'm not even sure if vaccine hesitancy of searching for a better word, but there would be you've seen the polling, and I've been asked by many of you to see that there's a certain percentage of people who say they're not going to take it. And I think part of that might be it was new. They didn't know that it was there. We're also seeing this in younger populations. I asked the question of why we're not seeing a higher uptake in some of these groups that because of their jobs are available to get it and they're not taking it. One of the answers those folks are giving is that we want others to get it first. They kind of feel like they're hopping the line. They're not, but we are seeing a little bit of that, and we're seeing from some of the providers. I actually was in contact with a small hospital provider who said his waiting list is 0 now. And they've done a fantastic job. They've done a lot. They've got all their doses out. They've done fantastic work. He said he's going to wait a week to order more as they go out and talk. So I've been kind of forecasting this for all of you. There's going to have to be a pretty concerted and coordinated effort around education pretty soon, because we've been talking about this since we started vaccinating. There would be a day, and we're planning for it when it's coming. There will be a day where we will have more vaccines than we have people who want it. I know that seems insane, what we've been through. But that day is coming, and what we need to do is continue. And what we've seen is the same thing we've seen in long-term care facilities. We did 3 passes through those, and each time we went through, the uptake got higher and higher. Resident uptake was very high in the beginning and got higher. Employee uptake was somewhat tepid, little more. So the answer is yes. The answer is we take that very seriously. The answer is yes, especially in communities. Once again, we're going to see through data we're under-vaccinating communities of color, and there's some historical resistance in those communities, and rightfully so, because of some of the things in the past that have been fairly traumatic around vaccination. So this is an issue we're going to have to all work on. I would make that pitch to you Minnesotans. This is safe vaccines, all three of them. It makes a huge difference both for you and for your neighbors and everyone else that we try and reach that minimum of 70% threshold. And I am still convinced, we'll see if I'm right about this, that sense of kind of civic duty that leads Minnesota to be tops in voting, tops in filling out the census, we think right now we are still trending ahead of other places with uptake, but it's not uniformly there. So it's a very good question. It's one that it's going to take some educating. What we know is, I understand this. There's certainly parts of the state, if I tell them to take it, that's not going to be helpful. And we need local folks to say, you know, this is what it is. And more importantly, we need these folks. That's why it's a nonpartisan issue for them. It's a health issue, but we want to get that there. So for Minnesotans, exciting day. Johnson & Johnson's vaccine's here. It's going to be in arms. We've got ourselves up now. They're doing this third fastest in the nation. Our deaths per 100,000 has dropped to 35th in the nation. Our hospitalization and bed usage is at a level we haven't seen in over 10 months. Our children were better protected through COVID. And last week you saw on Friday that our budget situation in Minnesota has us in a position where we can stabilize, take care of those who were hurt worst in this, and then start thinking about a future. And then that question that gets asked, we are certainly considering and thinking every single day about ways we can move us more back to those things what we want to do. And I think the way, if you want to know and look at it right now, those events that are further out, certainly June and beyond, those look pretty promising because of everything that's happening. And the speed of this vaccine development is pushing things, compressing the time that we're getting more and more people vaccinated, and that makes a huge difference on what we're able to do. So the day is coming, and it's coming faster than we would have imagined even several weeks ago. So good news. I want to give a final thank you to James, the folks at Fairview on so many fronts. And I'd like to note, we talk about this issue around equity. The system's already doing that. The systems know what they're doing. They're working at that too. Everybody's deeply concerned about this. I think we'll put out more information tomorrow or Friday around the gaps in communities of color, and then more importantly, a plan. I've been on with a lot of the grass top leaders and the folks who are in community about working of ways that we can do a better job of making sure we get those to the folks who want it, and then of course convince more folks that taking is the right thing. So thank you all. James, thanks. Dr. Yeager, thanks as always. Great stuff you did.